My office consists of a family practice. We treat patients of all ages, from pediatrics to geriatrics. We also treat sports-related and auto-related injuries in our office. Basically, our referrals are from our existing patients. They refer their loved ones, co-workers, and friends. And we also receive referrals from medical doctors in the local community. Our treatment is painless. We use no medication, and it is a drug-free type of treatment. It's all natural, allowing the body to heal itself. The adjustments are very light and safe. I personally have performed adjustments on tens of thousands of individuals safely, effectively, relieving their pain quickly. Well, for acute care patients, generally speaking, it could take as little as a few visits, upwards to several weeks, depending on, it's on a case-by-case basis. The technique that I use is basically called diversified technique. It's a manual form of adjustments. I use my hands to locate areas that are subluxated or locked up in your spine, and the adjustment is very gentle with a light touch. At times I also use an instrument called an activator, and the activator also is very specific and light on the adjustment, so it's pain-free. Subluxation is a misalignment between two vertebrae causing pressure or direct impingement on a nerve. That in turn affects the body's way of healing and expression, so it hinders the body's capabilities. I have 24 years of experience treating patients in the Orange County community. I've been performing tens of thousands of adjustments on patients safely and effectively, and I specialize in short-term relief care. After we have your health history form filled out at the front desk, we'll bring you in for a consultation with me, and that's where we basically discuss what your symptoms are. I ask you a number of questions, and after the consultation, if we determine that chiropractic care can help you, I'll perform an examination. In that examination, we perform an orthopedic, neurological, and chiropractic evaluation. If deemed necessary, we would refer you out for x-rays, and if your symptoms are severe enough, we also perform different diagnostic studies such as a nerve conduction study or MRIs. With the neurological exam, we're basically performing an exam to determine if there's some gross neuropathies, which means that the nerve is actually causing severe deterioration that could be severe. And in those cases, more often than not, we refer you to a neurologist for further evaluation. Orthopedic exam, we're performing orthopedic testing to determine and rule out whether or not, for example, you may have a disc herniation. And there's a series of orthopedic tests that we perform, whether it's in your neck, low back, or shoulder, etc. The last exam is the chiropractic portion, and that's where we're assessing whether or not you have a subluxation. And if we find that subluxation, we make objective findings on your examination form, and when we treat you, we actually specifically treat those areas that are subluxated to allow the nerve to, in essence, do what it needs to do.